Hey guys, it's Dr. Cordova. All right, today I wanted to talk about urinary tract infections, so UTIs. So what is a UTI? So to explain what a UTI is, I like to explain the urinary tract system as a whole and basically explain the anatomy of it. So it starts with the kidneys. So the kidneys produce urine. From there it drains into the ureters, which are little tubes that connect the kidneys to the bladder. So from the bladder, you actually have an outlet called the urethra. So anywhere along that system, it could get infected. So it's a lot more common for women to have infections in the urinary tract system as opposed to men. So some of the symptoms that people oftentimes have will be: one, they'll get pain with urination. Two, they'll have increased frequency, so they're going more often. They'll also have urgency, so you feel like you got to go, but you can't sometimes. Sometimes people will have fevers, sometimes people will have chills, sometimes people will have back pain, and sometimes people will have nausea, vomiting, and just associated symptoms depending on where the infection is. So in terms of a lower urinary tract system infection, that's oftentimes called acute cystitis, okay? So these are oftentimes pretty simple to treat, a simple antibiotic, and oftentimes your urinary tract infection will go away fairly fast. So when it starts going up into the ureters and into the kidneys, oftentimes people will get a lot sicker. So that's oftentimes called pyelonephritis. So with pyelonephritis, oftentimes people will get a lot sicker. So they'll get nausea, vomiting, they'll get some fevers, they'll get back pain, and it'll be a lot more severe of a urinary tract system infection, okay? So what are some of the things that are important during a urinary tract system infection? So one is to hydrate. You got to hydrate plenty. So to basically kind of flush that system of bacteria, hydrating with more fluids oftentimes has a better result in terms of getting over that infection. So the next thing is antibiotics. So antibiotics play a huge role in getting rid of urinary tract system infections. Common antibiotics are oftentimes things like nitrofurantoin, Cipro, Bactrim, Keflex, and there's a variety of different others depending on how severe the infection is. Where do you get treated for a urinary tract infection? Okay, that's a question that I oftentimes get. So there's a bunch of different modalities in terms of where people could go to get treated for a urinary tract infection. One is urgent care. So that's a very common thing. It's very easy to get treated in urgent care. So if you're having symptoms of a lower urinary tract system infection, oftentimes urgent care is probably a good bet to get treated for that. Another place you could go is a family practice doctor. So sometimes they'll have outpatient clinics or outpatient appointments that you could get scheduled to get treated for your urinary tract system infection. And it's fairly easy for most primary care providers. Sometimes it may be a little difficulty in terms of scheduling. Another thing is specialty clinics like IV clinics, such as Viva IV Therapy in Scottsdale, Arizona. You could schedule an appointment. They'll do a telehealth appointment for you and get you treated for your urinary tract infection. One of the other options is an emergency department. So the wait is usually a little bit longer in an emergency department, so I'd recommend an urgent care over an ER simply because of the wait, for one. But if you have more severe symptoms, like for example, you're having nausea, you're having vomiting, you're having really bad pain or something like that, that would be an indication to go to an emergency department as opposed to an urgent care, okay? So some of the common bugs that typically cause a urinary tract infection are E. coli, which is one. Sometimes people could have staph UTI. Sometimes people could have yeast. Sometimes people could have Pseudomonas, Klebsiella. There's so many other different types of bacteria that can cause urinary tract system infections. So how do we figure out if someone has a urinary tract infection in terms of from a doctor's perspective? So the biggest thing is history. So if you're having things like increased frequency again, the urgency, the pain with urination, the back pain, fevers, all that, basically those are indications alone to basically treat your urinary tract infection, okay? So other tests that you could actually do is something called a urinalysis. A urinalysis has a variety of different things that it tests in the urine. It could check the acidity of your urine. It could check to see if there's nitrites, so different bacteria could basically kind of convert different components to create that nitrite. So if it's positive, that would be an indication that there's bacteria in your urinary tract system. Another thing is leukocyte esterase. So basically the immune response would basically kind of create that that test to be positive in the urinalysis. Sometimes we could do a urine culture. So what a urine culture is they culture these different urine samples and they see if any bacteria grow out of there. It's very common for a physician to order a urinalysis and a urine culture. So the good thing about ordering a urine culture in terms of treating a urinary tract infection is that oftentimes physicians will guess, say, hey, this particular antibiotic should cover against the most common bugs and should treat your UTI. But antibiotics are being used pretty frequently these days, and oftentimes there can be some resistance. Getting to the bottom of that particular type of bug and the particular resistance to different antibiotics is very important in terms of treating urinary tract infections. If you're one of those people that has UTIs very frequently and you're using the same antibiotic from your physician very frequently, you may develop some resistance. So it's good to get a urine culture, especially if you're having frequent urinary tract infections. Another common question that I get is people will say, hey, I had a urinary tract infection. The urinalysis didn't show anything. It was negative based on what my doctor said, but the urine culture came back positive. So that's based on the particular type of bacteria that's in your urine and also the immune response that you're having to basically react to that infection, okay? So if your body's not really responding that well to the infection, or if it's a particular different type of bacteria, sometimes the urinalysis could have some results difficult to interpret. So I oftentimes treat people based on symptoms, and then I also send a urine culture and a urinalysis just to double check and verify the components that are basically present in the urine to treat that urinary tract infection effectively, okay? So if you're having any of those symptoms, the options again are urgent care, family practice, specialty clinics like an IV therapy clinic like Viva IV Therapy, and also an emergency department, okay? So those are all different options to get treated for your urinary tract infection. Another option that's very common these days is telehealth. So telehealth is very prominent. Different specialty clinics oftentimes have telehealth. Even your primary care doctor might have telehealth. Some urgent cares have telehealth. So don't be afraid to utilize that option, especially if you're feeling really bad and can't leave home. I would get treated for a urinary tract infection as soon as possible, okay? So if you're feeling so severe to the point where you can't eat and you're throwing up, you probably need to go to the emergency department like I mentioned earlier, and you might need to be admitted to the hospital to treat that urinary tract infection until you're able to tolerate oral medications or able to tolerate any food or fluids, okay? So that's all I have to say about urinary tract infections. If you have any questions, feel free to leave it in the comments, and I'm happy to hear about different experiences that you've had or different complications in terms of urinary tract infections, and tell me a little bit more about the complications or just questions that you have about the urinary tract system as a general, or just about different bacteria or whatever you need answered, okay? All right, if you have any questions, feel free to reach out to me. See ya. Bye.